Translating Research into Care, or TRIC grants. This PowerPoint presentation will give you a program overview and the requirements for the TRIC program. The purpose of the TRIC program is to support research at the point of care that will facilitate the translation of clinical science into improved delivery of services and patient care. TRIC grants are meant to change healthcare at the QE2 Health Sciences Center and the IWK Health Center now through implementation science research projects. Most of the healthcare work that we do at the IWK and the QE2 is pretty good, but not as good as it could be. Priorities for TRIC applications will be given to those studies that aim to improve patient-reported outcomes, improve the safety of healthcare, identify and reduce unnecessary costs, reduce wait times for healthcare, reduce the need for healthcare, reduce unnecessary interventions, and improve access for underserved populations. How is TRIC related to implementation science? Implementation research is the scientific study of methods to promote the systematic uptake of proven clinical treatments, practices, organizational, and management interventions into routine practice, and therefore improve health and health outcomes. Listed below are two excellent websites with more information on implementation science. So why TRIC? Why translating research into care? As I said before, we do a great job doing research, but it could be better. A lot of the research that we do and a lot of the evidence that is out there is not moved into practice. We have two valleys of death, so to speak, between biomedical research and clinical science, where a lot of research is lost in valley number 1, and again from clinical science and knowledge to actual health decision-making and clinical practice. There's so much evidence out there, but a lot of it sits in valley number 2. The purpose of TRIC is to take evidence that is already out there and to move it into practice to improve health. Hallmarks of the TRIC program include great research, grants that are co-led by QE2 and IWK researchers and administrators. TRIC funding covers the research costs, and the operational costs are absorbed by the health system and signed off by the administrative co-PI. TRIC will fund research that can be successfully implemented and sustained by the health centers. Scientific co-PIs must be employees, medical staff members, or have an affiliate scientist or a medical appointment at the institution where the research will occur, and for the duration of the project. Administrative co-PIs are employees at the QE2 or IWK health centers. They must have signing authority for the budget that will be impacted and the authority to approve the sustainability of the healthcare improvement over the long term. Deadlines for TRIC applications are May 1st and November 1st annually. There are 3 award levels. Level 1, which is up to $3,000 over a 1-year period. Level 2, which is up to $30,000 over a 1 or 2-year period. And Level 3, which is up to $60,000 over a 2-year period. Before preparing a TRIC application, consider the following. How will this research help change practice? How will this practice change impact the health system or patient care? Is there rationale for this practice change in the literature? Is the evidence there? Is this practice change supported by health center administrators? And is the impact of the project sustainable over the long term? TRIC applications are reviewed by scientists, health center administrators, representatives from health center foundations, industry, and patients. They consider the impact of the research on healthcare. They look at the scientific and administrative merit. They look at the implementation procedure. Is it feasible? Is it sustainable? They look at the budget. Is it appropriate? Are operational costs signed off by the administrative co-lead? And is the patient voice included? Some example anticipated outcomes from TRIC grants include new diagnostic and treatment procedures, better access to care, care that is more timely, more affordable, of better quality, addressing issues of effectiveness and efficiency such as wait lists, adoption of new technologies, generating new care delivery models, addressing service gaps, improving chronic disease management and the support systems around them, and responding to the needs of a geographically or culturally diverse population. To assist you with the development of your TRIC application, a variety of TRIC workshops are offered prior to each TRIC grant competition. Workshop presentations are available on the Research Services websites and include the following workshops: the TRIC program overview and requirements, which you are viewing now, patient engagement, implementation science, and health economics. There is a tremendous amount of support available to you as you develop your TRIC grant. There are consulting scientists at the IWK Research Services Office, the program leader research development at NSHA and IWK, the integrated vice president of research, innovation, and knowledge translation at NSHA and the IWK, the maritime SPOR support unit, the Public Engagement Office at NSHA, Quality and Patient Safety at IWK, the Research Services Offices, and the Research Methods Unit. There are a few points worth noting as you develop your TRIC application. Make sure you check the eligibility criteria. Review the TRIC application forms and guidelines and related documents. They are updated frequently. Ensure that your administrator-research collaboration is solid. This is a very important piece and the foundation of the TRIC grants. Patients or the patient voice must be included in the research. As you develop your budget, you can use as many pages as you need for the justification. Consider eligible and ineligible expenses, and use health center pay scales. CVs must be 5 pages or less, and also note that TRIC forms are locked documents. For assistance with the forms, contact Research Development. Submissions are due May 1st and November 1st at 4 p.m., or the next workday if it's a weekend. Submit one electronic copy in PDF format using the HITS Nova Scotia Send Secure File Transfer System. This PDF should be sent to Sandra Crowell. Do not send TRIC applications from a Gmail or Hotmail account. Sometimes they do not arrive. A list of all of the funded TRIC grants is available on the Research Services website. What follows are examples of Level 1, Level 2, and Level 3 funded projects. As we go through the titles, pay particular attention to how each research study could impact the way we deliver care and the way we can impact patient outcomes. From Ernest Snellgrove Clark and Jennifer West at the IWK, Second Stage Labor Management, a collaborative strategy for change. From Jill Hayden, Kirk McGee, and Samuel Campbell at the QE2, Management of Low Back Pain in the Capitol Health Emergency Department. From Jana Curran, Jocelyn Vine, Tricia Cochran, and Kathy Blades at the IWK, Improving Transitions of Care for Complex and Medically Fragile Children and Youth. From Marilyn McKay Lyons and Richard Braha, Stepping Up Aerobic Exercise at the Nova Scotia Rehabilitation Centre to Improve Health Outcomes After Stroke, a clinical feasibility project. The effectiveness of an online portal for the delivery of care to home dialysis patients. From Karthik Tenencore and Cynthia Stockman at the QE2. From Graham Rocker and Paula Bond from the QE2. Expanding the Inspired COPD outreach program to the emergency department, assessing feasibility, efficiencies, and outcomes. From Donna McDougall, Charmaine McPherson, Steve Ashton, and Katrina Philopoulos, a joint QE2 and IWK Health Centre project. The evaluation of the Nova Scotia District Health Authority's IWK Health Centre Influenza Control Policy. And from Anthony Otley and Karen Carter at the IWK, Mission is Remission. How can a disease self-management website change care? Funding for the TRIC program is provided by the QE2 Health Sciences Centre Foundation and the IWK Foundation. If you need assistance while you are developing your TRIC application, you can contact Dr. Patrick McGraw, the Vice President, Research, Innovation, and Knowledge Translation for NSHA and IWK, Sandra Crowell, Program Leader, Research Development at NSHA and IWK, Dr. Jill Hatchette, Consulting Scientist, Research Services at the IWK Health Centre, and Elaine Strom, Administrative Assistant, Research Development at NSHA.